Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Raghu Narayan. To give you a brief introduction about Dr. Raghu Narayan, Dr. Raghu Narayan is a professor and microendodontist and graduated from the M.R. Ambedkar Dental College and Hospital, Bangalore. He has a master's in endodontics from the Rajiv Gandhi University of Health Sciences, Bangalore. He has done advanced endodontics course in the University of Florida, microendodontics from the University of Buffalo, and a master clinician training at the University of California, UCLA. Dr. Raghu has experience of more than 2 decades in clinical dentistry. He is an active member of the national and international endodontic societies and has conducted lectures and deliberations about modern endodontics at national and international conferences. Dr. Raghu has published articles and columns regarding modern dental treatments and advanced endodontics and frequently published national newspapers and dental magazines. Dr. Raghu is a founder, director, Academy of Advanced Endodontics, Bangalore, and has trained more than 3,000 dentists in modern endodontics concepts across the globe. He is also program director of Advanced Endodontic Principles program at the University of Buffalo. Academic director of Modern Endodontics at the Dental Academy for the Clinical Excellence, USA. He is also a research advisor and key opinion leader for various national and international manufacturers. Currently, Dr. Raghu conducts advanced endodontic courses at the Academy of Advanced Endodontics and also maintains a private practice with his wife, Dr. Shweta Narayan, at Indranagar, Bangalore. His dental office specializes in microendodontics, retreatment endodontics, aesthetic dentistry, and in implants. Dr. Raghu, thank you so much for joining me in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you, Dr. Rekha. Thank you for having me here. It's my pleasure to share a little snippets about the whatever I know, a little bit about the dentistry. Thank you so much for
Yeah,
having me here.
thank you. Thank you. I know you are an endodontist who is a specialist in endodontist and microendodontics. Of course, there are so many topics that we can cover in the topic of endodontics. But currently, since we are in a situation today in the COVID pandemic crisis, I was just wondering what your insights are about the current situation pertaining to dentistry in particular.
That's a confusion in general. Almost all the dentists and general public is having. What is going to happen to the dentistry as a profession, and what is the implications of practice from the corona perspective? I divide this question into two parts. One is like from the society perspective and from the professional perspective. From the society perspective, the fear is valid. Like how can we go to the clinic and how can we trust the whole scenario whatever was happening. But one thing I can assure the general public is dentists are experts in management of infections and related disinfection protocols and all those things. We are day in day out we work with the infections. That's our
Yes.
bread and butter. So we are very clear on that one. We know how to take care of that. So that a confusion like what how do they manage it? We have a protocols and we are going to manage that. From the professional aspect, what happens is okay, there is a kind of what you say a set protocols we used to follow. Now we just need to tweak them and enhance our procedures and the protocols focus more towards the viral based infections. It, this is the way I would see the changes post COVID in crisis.
Okay. Okay. So, Dr. Raghu, you are saying that we have to tweak the existing protocols. So, when you say we have to tweak the existing protocols, what
Of
exactly
course.
will there be some additionals that we have to do to the existing protocols?
Definitely, definitely. The way it's, the patient used to walk in. The normal protocol used to be the patient walks in and we take them in and we start asking them the questions and we start a treatment. Now that whole process is going to be like okay, there will be a 2-3 levels of filtering. when patient walks in, there will be a certain procedures. We need to make sure that only patients are allowed, or only a significant, if it is required, only a one helper is
Yeah.
allowed in the clinic, and then monitor them and ask them a specific things about his recent general physical health and his travel history and
History.
his whereabouts and all those things, which was not considered to be, though it was a part of the overall process, but we were little lenient about those things.
Yes.
But now that is
Yes.
going to be a strict thing.
Yes.
And the second level is like, before we start the treatment, we really evaluate whether do we need to start immediately or can we postpone it for a while. It's not that patient walks in and we jump onto the treatments. No, we would like to avoid, uh, categorize them whether it is an emergency or non-emergency treatment. And then when we start the treatment in the emergency category, there will be a set of protocols ranging from, common man now is very familiar with the PPEs, personal
Yes.
protection equipment, but that is the one aspect. There are many other things we are going to take care of that. And of course, that is going to have an influence on the duration of the treatment time and the cost factors and many other things, of course, that will come as a package. Uh,
Okay. So, Dr. Raghu, you said there would be some kind of emergency procedures and non-emergency procedures. So, since you are an endodontist, and that which means you are a root canal specialist. So, I think by now most of our patients are aware that root canal treatment is done during a tooth pain. So, what exactly in the immediate future, if there is a requirement for a dental emergency, which is a tooth pain treatment, how exactly do you think dentists would be taking precautions to treat those kind of patients?
Okay. When you ask that question, that's a perfect question. Everybody wants to know about that. How do we deal with that? One thing is taking an approach considering the patient is a COVID positive. And the second thing is taking a patient as a
Carrier.
non-contaminated, non-infected patient. Okay, there will be two categories, but for us, we'll have a better edge if we consider the patient is positive. So
Yes.
now our biggest question is, can we do some sort of a testing? At this point, the way I see, since I have certain resources to get in some information, we may have testing kits easily available. If that happens, 90% of our problems are solved. So we're
Sorry.
going to test the patient whether it is required, whether he's positive or not. If he's not positive, that means that okay, everything is assured, and we are going to go ahead with a routine procedure. If he is positive, still we can treat him.
Yes.
Only thing required is, okay, now uh, he has to be completely asymptomatic,
Yes.
and we have to make sure that the drills what we are going to use it. My specialty, we totally depend on aerators, which
Yes.
works at the 30 pounds pressure of air and water, and there's a lot of spillage, and bioaerosol goes up to a meter and all those things. But now let me say this one. I wouldn't be using that equipment. I would probably use a slow speed micromotors, which doesn't require a pressurized air or
Water.
a water. In that context, so I can completely avoid that spill out of the saliva and all those things. And of course, the PPEs and the other protocols of like asking the patient to sterilize his use of
Hand.
certain mouthwash and other things, and patient is also covered with certain PPEs, and those
Yes.
things can be taken care. And now the most important thing is, before and after this patient there will be a downtime. So we're
Yes.
going to completely sterilize, fumigate the clinic,
Yes.
make sure that the clinic is sterile, my assistants are protected, I am
Yes.
protected, my family is protected. Of course, these are the protocols we are going to set, and then that is how we're going to deal with those emergency cases. The
Yes.
percentage of that is like less than 1%, if I
1%.
see 100 patients.
Yes, yes. So more or less at this time, it is a telephonic consultation that is happening, and mostly it's prescription of medicines to try to push the, or try to relieve the patient of immediate pain right now.
Yeah, the telemedicine is one way of looking at it. See, when we are discussing about a corona-based practice, it is during the lockdown and after the lockdown.
Yes.
Once we open up, once our government or our council says that
Or-
okay, go ahead and do the non-emergency treatment, then what we're going to do is a most critical question.
Yes.
Telemedicine is always there. It is really helping us to a
Yes.
very large extent. But dentistry being considered as a reparative treatment mode, we don't have just prescribe something and gets
Yes.
cured. We have
Yes.
to intervene and we have to
Yes.
do something. From that context, we cannot go on forever. We
Yes.
cannot keep postponing the cases forever. Hence, the day we start, again, we're going to categorize them. Visually, we're going to examine them. We are going to do certain investigations and see, can we again postpone for a while? If not,
Yes.
can we start something? It's already 3 or 4 weeks up, and there are already cases are getting piled up.
Kind
We
of
are talking about a 1.3 billion population served by nearly around a lakh clinic, and none of them are working as on
working.
today. And
Yes.
that is a huge, huge number of another level
Pile
of
up.
crisis which is going to pop up
Yes.
very soon.
Yes, yes. So Dr. Raghu, like you said, there would be some amount of upgradation only, let us say, in terms of sterilization protocols or patient history protocols, and in personal protection protocols, both for the patient and for the dentist. So these kind of this would kind of add a burden. It's an increased expenditure that the dentist has to incur, isn't it? So what do you think the repercussions of this kind of a renewed protocol would be?
Definitely, there will be a certain financial repercussions on the practice and as well as the patient pocket. Now, the way I see is, see, this is a totally unprecedented crisis that happened to our country or globally. Nobody
Yes,
were prepared. We
yes,
started spending extra for our sanitizers and our hoarding of the food and other things and the mouth masks and all those things. At every level, the prices have gone up, from the
no,
vegetables to the, you name it, and it has
I
gone
know,
up.
I know.
And now, fetching that same thought on the profession itself, yes, there will be certain repercussions, the certain changes in the price and all those things. That will be purely on the PPEs what we are going to procure and the additional procedures what we are going to do. It's
Yes,
not because just because the virus has come and I'm going to hike the price for no apparent reasons. No, there will be a valid reasons, and I'm sure that every dentist is going to give a very clear clarity
yes,
about that, why that is being charged
sure.
extra. And at present, the good signs what I'm seeing is, like, a few weeks back the PPs used to be exuberantly priced, and the prices are suddenly, they're really really coming down on a daily basis. So I think by the next weekend or a month end, we should have a very reasonably priced, very
Priced.
well tested,
Mm.
very well available PPEs, so which can protect the society at large, and dentist as a professionals.
Okay, that's really good news, Dr. Raghu, to hear and know that the personal protection equipments, what the dentist will need, and also they'll need to provide to all their assistant, other staff in the dental clinic, because I think in treating one patient, we will need at least two or three other kits made available apart from the dentist to all the other people in the staff. So I think considering what we did here a couple of weeks ago about the costs of these equipments and these protection gears, I really hope, probably, by the time I telecast this on the channel, I think the cost would have come down further.
Definitely. I would like to add one more point here. Today morning itself, I did speak to concerned people at our dental association, and they are really, really working hard to put the things together, trying to speak to the manufacturers and the importers and all those things, explaining them the need of an hour, and how to bring down, and how that particular aspect can contribute to the overall health. So they're really doing a great job to bring down these prices and making it available for all professionals.
Yeah, I think that's really good news, and hopefully, say in the end of May or probably June, even we are hoping to get
Yeah,
back to
yeah,
practice. So if that is possible, and like you said, if test kits would be more easily available, so that we can test the patients at the clinic itself, screen them at that level. So I think a
yeah,
lot of cases who probably would go undetected, like asymptomatic
yeah,
cases who are actually probably are carrying the infection. Probably as dentists, even we can detect them at that
yeah,
level.
yeah.
So
Uh, if
yeah,
I can add up
yeah,
one more point here, general public suspecting us that maybe there is a possibility of cross contamination is very, very valid. At the same time, it becomes an additional responsibility for a dentist to make sure that, assuring the patient that I am not positive, my assistants are not positive, and we have not traveled anywhere, and we
correct.
are monitoring our own health, and I'm tested for myself, and this assurance is very, very critical before asking a patient that are you positive.
Yeah.
So there has to be a very transparent
Yes.
communication between both the
Conversation.
sides. Yes, saying that when I'm clear, are you clear from your side?
Yes.
uh, it cannot be like one-sided a story for a patient. So
Yes.
I would say that there need to be two kind of consents. Patient gives a consent saying that one his whereabouts and travel history and his health history and all those things. At the
Yes.
same time, even a dentist has to do that one from his team perspective.
Yes. Yes. So honesty at both the ends, both from the patient's end and from the dentist's end, is really important to keep up the trust and to continue with the dental treatment procedures.
Yes.
So, Dr. Raghu, would it be too early to say that probably we dentists will get some kind of a certification from regulatory bodies regarding our screening and our health status?
What I've been hearing since a few days is like Dental Council of India is making the committees, and they are going to come up with protocols for each treatment, probably, or each specialization, do's and don'ts. And from that context, yes, there will be certain monitoring that will happen, both from the council side and from the government side. But more than these things, like when a dentist is practicing in his setup, he is not he is responsible for his own thing,
Yes.
and I'm pretty sure that everybody is like morally and ethically binded to certain things, and
Yes.
they would take a right thing.
Yeah. Yes. 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 I think these are the times when we have to really take responsibility of keeping the community safe, because we are also part of the same community. So
Definitely.
it really becomes important that everybody stay safe and healthy. So Dr. Raghu, I'm really hoping this lockdown period would probably end May 3rd, but even if it gets extended for a couple of weeks more. So whenever it ends, hopefully we also can get back to our active practices and help our patients
Yes.
out who have been waiting so patiently for us.
Yeah. More than a livelihood for us, this is like serving the society,
Yes.
and which we've been doing it for a very long time. And we know a certain sector has been affected with the
Yes.
many other health issues. And
Yes.
during this lockdown, everything has been either sidelined or not given importance and all those things. And that cannot go on for a very long time. So very soon, those laterally the other comorbid
Content.
issues that will pop up, and very soon we should be able to address and serve the society.
Okay. Dr. Raghu, like you said, probably once we get back to active practices, there will be some kind of modulations that will happen in terms of the treatment timing, the treatment procedure, and also the cost of the treatment. So I think our patients should be prepared for some changes. Hopefully, all the changes that happens for the best.
Definitely, definitely.
Definitely. So that was a very informative talk, Dr. Raghu. Thank you so much for sharing your expertise and your information regarding how probably dental treatment procedures would be post COVID session.
Thank you so much, Dr. Rekha, having me here, and you've been doing a wonderful job to bring a lot of awareness to the general public. And we don't have much of a communicative channels to reach out to the general public. And this has been a wonderful, wonderful platform you have created. And I really appreciate your effort to reach out to common man and tell them the professional story, what is happening on the other side. I wish you all the best, and thank you for giving me the platform to share
Thank
my
you.
thoughts. Thank you.
That was very kind of you, Dr. Raghu. Thank you so much. And considering you're an endodontist, I hope I can get you back to do many more talks and inform our patients about
Sure, sure. I would
RCT
love to.
procedures and all that. Thank you
I
so
would.
much.
Thank you.
Viewers, that was Dr. Raghu Narayan, who did talk to us about how dental treatment procedures would look like in the post-COVID situation. I hope that talk was helpful to you all. In case you have any doubts or queries, please write your concerns to us and we will get back to you on that. And I will put up a list of dentists that you can contact in case of emergency in the description box below. Please do not hesitate to contact any of the dentists there. So to get more information about your oral and dental health, do visit our website www.thedentaire.com. Do subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. So until next time that I come back with another dentist with another topic on your dental health, stay safe, be happy, and keep smiling. Thank you.